Every second counts. Did you know a stroke can happen in the blink of an eye and change a life forever? In this video, we'll show you how to spot a stroke, what causes it, and how it can be treated or even prevented. Whether it's for you or someone you love, understanding stroke could save a life. Let's see what is meant by stroke. Stroke is a brain attack, causing an abrupt interruption of constant blood and oxygen flow to the brain. This occurs as a result when the blood vessel feeding the brain gets clogged or bursts. Why it is a more important topic to discuss. We'll see a few worldwide statistical data. 11.9 million new incident strokes annually. 93.8 million people living with a past stroke worldwide. 7.25 million deaths from stroke annually. Do you stroke had 3 different types based on the symptoms and clinical findings. First, ischemic stroke. This type occurs when a blood clot or other obstruction blocks blood flow to part of the brain. 87% of cases fall into this type. 2. Hemorrhagic stroke. Occurs when a blood vessel in the brain ruptures, causing bleeding and damage to brain tissue. 3. Transient ischemic attack, TIA, a mini-stroke that temporarily blocks blood flow. How come we know the person is having stroke? Let's dive into the symptoms to recognize easily. Time is critical. Recognize the signs using the acronym FAST. Ask the person to smile. Raise the arm. Ask them to speak to see the symptoms. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call emergency services. Along with that, other symptoms include vision problems, confusion, dizziness, and sudden, severe headache. If the symptoms are positive, we will tell like FAST positive. Call to emergency service. Or if patient was in minors, move to resuscitation area as soon as possible. You may think now, is there any risk factors, causes for the stroke? Several conditions and habits increase the risk of stroke. High blood pressure, smoking diabetes, high cholesterol obesity, lack of exercise, excessive alcohol consumption, age and family history also play a role. Let's see how to diagnose the stroke. With a few tests, we can diagnose like neurological exam to check brain and nerve function, reflexes, vision, coordination, etc. Imaging tests, CT scan, usually first. To detect bleeding or large strokes, MRI, provides a detailed image of brain damage. Blood tests, to check clotting time, sugar levels, and infection. Carotid ultrasound, to check for narrowing of arteries in the neck. Echocardiogram, to look for heart problems that may cause clots. Most important one, how to treat a patient with stroke. Timing is more important when coming to stroke. Treatment should be done within an hour of symptoms onset. 1. Ischemic stroke treatment, caused by a blood clot blockage. Tissue plasminogen activator, a clot-busting drug given through an IV, most effective within 3 to 4.5 hours of symptom onset. Mechanical thrombectomy, a procedure where a catheter is inserted into a blood vessel, usually in the groin, to physically remove the clot from the brain. Best if done within 6 to 24 hours of symptom onset in selected patients. 2. Hemorrhagic stroke treatment, caused by bleeding in the brain. Goal: control bleeding, reduce pressure on the brain, and prevent further damage. Immediate care: blood pressure medications, to reduce further bleeding, reversal of blood thinners. If the patient is on anticoagulants, like warfarin, medications are given to reverse their effect. In severe cases, surgical options need to be considered. They are aneurysm clipping or coiling, to stop bleeding from a burst vessel. Craniotomy, removing part of the skull to relieve pressure, in severe cases. Drainage of hematomas. If there's a large collection of blood pressing on the brain, stroke patients need to be in rehabilitation. Recovery starts as soon as the patient is stable, often within 24 to 48 hours. Multidisciplinary rehab may include physical therapy, regain movement and coordination. Occupational therapy, learn to perform daily tasks again. Speech therapy, for speech and swallowing problems. Psychological support, to treat depression, anxiety, or emotional changes. Cognitive therapy, improve memory and attention. Even though symptoms recovered, patients should be in long-term preventive medications. Antiplatelet drugs, aspirin, clopidogrel, to prevent clot formation. Anticoagulants, for people with atrial fibrillation, blood pressure medications, cholesterol-lowering drugs, diabetes medications, if needed. Time is brain. A stroke is a medical emergency. But with fast action, many people survive and recover. Remember, FAST. If you found this video helpful, give it a thumbs up, subscribe for more health content, and share. Subscribe, because the more we know, the more lives we can save.